Are you new to contacts and want to know how to put on contact lenses? I myself have been wearing contacts for almost 30 years now, and in this video I'll show you the easiest way to put on those contacts. Coming up. I'm Dr. Aaron Smith, and in this channel I go over the best tips and products for eye health. So if you're interested in this topic, consider subscribing and hitting that bell to be notified when new videos come out. And watch until the very end of the video where I'm going to go over what to do if you can get the contact lens to touch the surface of your eye, but it doesn't want to let go of your finger. It stays stuck to your finger and won't stay stuck to your eye. That and other bonus tips coming up at the end. So step one is to always wash your hands and dry them with a lint-free towel. One of your worst enemies when putting on contact lenses is a brand new bath towel, even though they're so soft. You might not see it under normal bathroom lighting, but the amount of fibers that a new towel sheds is way too much if you're trying to avoid getting lint trapped under your contact lens and the surface of your eye. That causes enough pain to where you'll have to remove your contact lens, rinse, and then reapply it to get rid of that painful lint. Step two is to peel open the blister pack of the contact lens, take out the contact lens, and place it on the index finger of your dominant hand in the shape of a bowl. It's going to look like that. One tip here is to make sure that the contact lens is not inside out by analyzing the very edges of the lens, the very outer edge. As long as all the edges are pointed up like a bowl, you're ready to put the lens on the eye. If you look at it and the very edge is flipped out just a little bit like this, then you have to flip it right side out before you place it on your eye. Step three is to place it on your eye. Are you ready? At this point, I just want to take a second, boost your confidence a little bit by letting you know that as long as that contact lens is still nice and wet and there's no lint in the contact lens from the towel, the contact lens should feel totally comfortable after you place it on your eye. Sometimes it's the fear of the unknown that keeps people from wanting to try contacts. Okay, so total confidence, you got this. Here we go. With the contact lens on the index finger of the dominant hand, use the middle finger of that same hand to pull the lower lid down. And then using the middle finger of the non-dominant hand, raise the upper eyelid out of the way. Bring the contact lens to the surface of the eye slowly until it's on the eye. Be sure to avoid even slightly bumping into the eyelashes or the eyelids in any way. In my experience in helping hundreds of people learn how to use contacts, this is probably the #1 reason why people run into complications when first learning to use contacts. They're not using the mirror to make sure the edge of the lens doesn't interact with the eyelids and the eyelashes. Bumping the lids and the lashes causes the contact lens to lay down on one side, and then you have to replace it on the finger correctly to put it back on the eye again. It'll never go on the eye if it's laying down with one side on the finger. You always have to make sure all edges are off the finger before you place it on your eye. It's totally fine to look up right before the contact lens makes contact with the surface of the eye if you need to, as long as you're avoiding touching the lids and the lashes. Here are a couple bonus tips. So if you've made it past the eyelashes and even had the lens touch the surface of your eye, but the lens stays stuck to your finger and you can't get it to stick to the surface of the eye, try this. When approaching the eye with the contact lens, land the contact lens more gently on the surface of the eye so there's still a small air bubble under the lens. When the lens is making contact with the eye, just barely, you want to slowly peel your index finger off the lens instead of pulling it straight off the eye. It's a lot easier to break that hydrogen bond from your finger by rolling the finger away from the contact lens rather than just trying to snap your finger away from the eye after the lens is touching it. Never press too hard. You'll cause it to flip inside out in some cases. When you've successfully removed your finger from the lens, before blinking, roll your eyes back and forth a few times. What that does is it gently nudges that little air bubble that's trapped under the contact lens out of the contact lens and helps avoid blinking that contact lens right off the eye after you've perfectly placed it on your eye. Here are a few of my #1 takeaways that I tell all my patients after teaching them how to first use contacts. First, never sleep in any type of contacts anytime. Then, avoid using contacts in water because it increases the chance of eye infection. Always throw away contacts that have expired. And if you ever feel like your eyes are infected, then visit your eye care provider immediately. Don't sleep on it thinking it's just going to get better. Contact lens wearers are more at risk for infections like corneal ulcers. That's like a canker sore on the eye, and it can leave permanent scarring and lead to permanent vision loss or blindness. Smash the like button if you found value in this video, and let us know in the comments if you have any tips or tricks to put on or take off contacts. And then watch the next video on how to properly remove a contact lens. If you've mastered that, then you might be interested in watching my video that explains the fear fear that some people have of a contact lens getting stuck behind the eye and if that could even happen or not. And I'll see you in the next video.